Switching over the clinical picture, the 80% cases are asymptomatic. 80% of cases of the hepatitis C infection, they are asymptomatic. And the symptoms are divided into the most common symptoms and the less common symptoms. The symptoms, most common symptoms are just like the flu-like symptoms, such as the nausea, vomiting, fever, loss of appetite. These are the non-specific symptoms. And these rare, the less common symptoms are dark urine, light colored stool, and jaundice. Dark urine is due to the unconjugated bilirubin in the urine. This is a typical course of the acute viral hepatitis caused by the hepatitis C virus. And there are the different phases. First one is the incubation period, and in this incubation period there are the prodromal symptoms. Then is the pre-ecteric phase, then is the ecteric phase, and the ultimately the patient tries to convey, goes into the convalescent period. So these are different phases: prodromal phase, pre-ecteric phase, ecteric phase, and the convalescent phase. How will we come to know that he or she is infected? This needs the laboratory aid. The Through the laboratory investigations, we come to the conclusion that patient is infected with the hepatitis C. The first type of the diagnosis the, is the serological assay of the antibodies. So the first test which we prescribe for the detection of C virus is the serological assay of the antibodies, anti-HCV antibodies. And these antibodies are determined, are identified These antibodies are determined or identified by different methods. So these methods are the KIT method, that is the rapid HCV antibody test. The anti-HCV antibodies are also determined in the saliva. So this test is known as thoracic test for the HCV. And this is a bedside test. This is a point of care test. So this is rapidly determined. And the other method is the enzyme immunoassay. This also detects the antibodies, anti-HCV antibodies, and the latest method is the chemiluminescent assay. This is by some instrument, and then is the fourth one is the recombinant immunoblast assay. This is well known as a REBA. REBA stands for the recombinant immunoblast assay. These tests 1, 2, 3. These are verified by the other tests such as the RIBA or PCR. So the enzyme immunoassay and the CLI, RIBA, DCLI, and these three tests they needs to be confirmed by the RIBA or PCR because these three tests they cannot distinguish between the acute and chronic infections and false infections. Nowadays, the third generation enzyme immunoassay screening is performed and this detects the antibodies against the HCV4 antigen and also these antigens NS3, NS4, they are also determined by the third generation enzyme immunase. The confirmation of the hepatitis C virus needs the molecular acid, and that is the nuclear amplification test, that is the PCR, and this detects the HCV RNA. HCV RNA is detected by the polymerase chain reaction PCR, and this is one of the amplification. In this test is of two types. PCR may be of two types. One is the qualitative and the other is the quantitative. In the qualitative, we decide, the test decides either the patient is infected or not. While the quantitative test, this shows us the viral load because the viral load is necessary for the treatment purpose. So mostly the quantitative PCR is advised because the consultant wants to know the viral load, the baseline viral load. This needs this needs the appropriate treatment. So this is necessary to know the baseline viral load. Genotyping is also necessary in case of the hepatitis C virus infection when there is the chronicity or there is a cirrhosis or the hepatocellular carcinoma. So the genotyping also needs to be to be detected because the treatment also varies according to the type of genotype. The other test which we require are the HCV core antigen test, and this core antigen test detects the acute infection in window period when there is the antigen is not present, but the and when the antigen is present while the antibodies are absent. So this is a window period, and the immunoglobulin M, anti-HCV immunoglobulin M determines the acute infection. As you know, the immunoglobulin M determines the acute infection, while the immunoglobulin G that determines the chronic infection. Liver function test. This is essential to see the liver function test. Either the liver functions they are altered or not, they are disturbed or not. liver function tests, they are necessary, such as the AST. These are the transaminases AST, ALT, and gamma GT. And we also need to know the prothrombin time and the activated prothrombin time, and these the liver function test, they are also required to decide whether the patient is stable or not. Liver biopsy, this is an invasive procedure, is not commonly indicated, advised, because this is an invasive procedure. However, the grading of fibrosis for the how much the architecture of the liver is disturbed, so this decides the liver biopsy. Liver biopsy will decide, and the one of the tests, that is the fibroscan. This this scan or this test decides, determines the stages of fibrosis, the stages of the cirrhosis in which there is the fibrosis. Fibrosis, the fibrosis is present in the cirrhosis, so this is a fibroscan test is important, and then is the ultrasound of the liver. So, what is the aim of the treatment? The aim of the treatment is to achieve the sustained eradication of SVR, sustained virologic response. ये response sustained हो कि treatment हम जो दे रहे हैं उसकी response हम देखते हैं कि अभी वो उसका जो एंटीजन है या जो टेस्ट है वो नेगेटिव है कि पॉजिटिव है, इसकी सस्टेन virological response हम देखते हैं when we have given the treatment. And second aim is to prevent the progression. So the treatment is based on the treatment varies according to case by case. If it is either it is acute hepatitis or chronic hepatitis, which type of the genotype is present, and at what level the liver functions are disturbed, uh, and either there is uh, present any other comorbidity or not. So this depends, the treatment depends on the various factors. In case of the acute hepatitis C virus, the treatment is for at least the 24 weeks. As soon as we determine the patient is infected with the hepatitis C virus, we immediately do not start the treatment, but the delay of treatment for 8 to 12 weeks, because 50% of the cases clear virus spontaneously. So there is a delay of treatment for 8 to 12 weeks when the patient is diagnosed with the acute hepatitis C virus, so that patient can recover itself, himself or herself, and after this period, then we decide to give the proper treatment. The treatment is the big interferon, the interferon. It is given with or without the ribavirin with the antiviral drug for 24 weeks, and this has the sustain, sustainable virological response. 80 to 90% of the virology sustainable virological response. So the treatment is by the regulated interferon alpha with or without ribavirin for 24 weeks. This is in case of the acute hepatitis C virus, acute HCV hepatitis. However, in case of the chronic hepatitis C virus, the treatment is longer, more than 24 weeks up to the 48 weeks, means the 1 year, at least the 1 year. And these interferons are given, however, these interferons, they are given by the parenterally, by the subcutaneous method. So this is not a preferred way of giving the treatment. Nowadays, the oral antiviral drugs they are given, and sometimes the pegylated interferon and the antiviral drugs such as ribavirin, they are given together for 24 days. So thanks for listening to me. And if you think this PPT or this video is informative for you, so please do not forget to like it or to subscribe it. Thanks for listening to me.